Greetings, everyone, and welcome back to Breaking Bulletin, your premier source for critical global developments. What do you think about the ongoing struggle to ensure enough hospital beds in Edmonton, a city grappling with growing healthcare demands? Please like this video, share it with others, and subscribe with the notification bell activated so you never miss an update as we dive into this pressing issue. Today, we are exploring a vital question facing Alberta's capital. How is the province addressing hospital bed capacity in Edmonton? This topic, spotlighted by CBC News on March 13, 2025, at 17:23 PDT, reveals a healthcare system under strain and a government scrambling to respond. Edmonton's hospitals have long been stretched thin, with emergency departments overcrowded and patients waiting in hallways, a crisis that has only deepened in recent years. The Alberta government, led by the United Conservative Party under Premier Danielle Smith since October 11, 2022, announced a significant plan on March 13, 2025, to bolster bed capacity. Health Minister Adriana Lagrange unveiled a proposal to expand to Edmonton hospitals the Misericordia Community Hospital and the Grey Nuns Community Hospital by adding new towers, potentially creating up to 700 new acute care beds combined, as reported by CBC News. This initiative, starting with a modest $1 million investment for planning, aims to alleviate the pressure on emergency rooms where wait times currently range from 3 to 9 hours per posts, found on X from the Alberta Civil Liberties Research Centre on March 13th. To understand this fully, we must trace the history of Edmonton's healthcare infrastructure, examine the current bed shortage, and assess the province's multifaceted response, providing you with the background needed to see the full picture. Edmonton, a city of over 1 million people within a metro area exceeding 1.4 million, per Statistics Canada's 2024 estimates, relies on the Edmonton Zone of Alberta Health Services, or AHS, for acute care. The Edmonton Zone oversees major facilities like the University of Alberta Hospital, Royal Alexandra Hospital, and the Misericordia and Grey Nuns Hospitals, serving not just the city but northern Alberta, parts of Saskatchewan, and the Northwest Territories. As of 2024, AHS reports 8,785 acute care beds province-wide, with 3,448 in the Edmonton Zone, per the Health Quality Council of Alberta. Yet, studies reveal a stark deficit. A 2022-23 EB Group report commissioned by the Alberta government and cited by the Edmonton Journal on March 8, 2024, found the Edmonton Zone short 514 beds as of 2023, a gap projected to rise to 1,539 by 2027 and to 926 by 2037 without intervention. Internal AUS documents from January 2023 leaked to CTV News Edmonton on February 9, 2023, warned of a 1,500-bed shortfall by 2026, ballooning to 3,000 by 2036, driven by population growth, an aging demographic, and in-migration. This shortage manifests daily. In fall 2023, over 150 admitted patients waited in Edmonton's 325 emergency department beds, per the Edmonton Journal, creating gridlock and ambulance shortages. By early 2025, AHS data showed Edmonton hospitals averaging 106% capacity, with 135 patients lingering in emergency rooms daily, often in makeshift spaces, per CBC News on March 13, 2025. The province's latest response, the 700-bed expansion targets to Covenant Health facilities. The Misericordia in West Edmonton currently has 312 beds, including 10 ICU beds, per the University of Alberta's Department of Critical Care Medicine. The Grey Nuns in southeast Edmonton has 349 beds, also with 10 ICU beds. Lagrange's plan, per CBC News, involves constructing new towers at each, though the $2 million planning fund announced on March 13th is a preliminary step with construction costs and timelines undisclosed. Critics, like Friends of Medicare's Chris Galloway in a March 14th X post, question the timeline, cost, and staffing feasibility, noting no new Edmonton hospital has opened since the Mazankowski Alberta Heart Institute in 2008. This builds on prior efforts. In December 2023, Oz added 12 surge ICU beds in Edmonton amid a respiratory virus surge, bringing the total to 240 province-wide, per CBC News on December 14, 2023. Yet, ICU capacity hit 93% by March 12, 2025, with 209 of 224 beds occupied, per an X-post from @YikoBoy, underscoring persistent strain. The government's Budget 2025, tabled February 27th and cited by X-user @Walamid on March 13th, pledges funding for these 700 beds, though critics argue it fails to address overworked staff. Broader strategies include accelerating discharges and adding overcapacity spaces, per AHS statements to CBC News on March 13, 2025. Historically, Alberta's healthcare faced cuts in the 1990s under Premier Ralph Klein, having beds from over 16,000 to 8,430 to by 2015. Per a University of Alberta study in the Edmonton Journal on February 9, 2015, population growth Alberta's rose from 3.2 million in 2000 to 4.5 million in 2024. Per Statistics Canada outpaced bed recovery. The COVID-19 pandemic exposed this fragility. By September 2021, Edmonton's own ICUS hit 91% capacity with 150 beds, per the Edmonton Journal on September 23rd, prompting triage protocol preparations. AHS sought out of province help, per CBC News on September 16, 2021, as total occupations peaked at 270. Post-pandemic, respiratory viruses and a primary care shortage. 40% of Albertans lack a family doctor. Per the Alberta Medical Association, in 2024 worsened emergency room pressure, per Dr. Ken Parher in CBC News on December 14, 2023. The province's response extends beyond the 700 beds. AHS deployed mass casualty stretchers in early 2025, per the Alberta Civil Liberties Research Center on X, and moved EMS under a new health entity in November 2024, per CBC News on March 13, 2025, to streamline patient flow. Yet, a shelved South Edmonton hospital, promised by the NDP in 2019 at $1.8 billion, remains a sore point. The United Conservative Party halted it, per Rachel Notley's February 9, 2023, comments to CTV News Edmonton, leaving critics like Galloway arguing it would have added 509 beds sooner. Edmonton's hospitals serve a vast region. The Royal Alexandra, with 29 ICU beds, and the University of Alberta Hospital handle transplants and advanced care, per Oz data, amplifying the bed crisis's ripple effects. Economic and trade factors compound this. Trump's 25% tariff on Canadian goods, effective February 1, 2025, per CBC News, strained Alberta's budget, though a 30-day pause followed Canada's $1.3 billion border security pledge. Healthcare funding lags Alberta's 2024 budget, allocated $26 billion to Oz, per the government's fiscal plan, but critics say it falls short of inflation and demand. Per the Edmonton Journal on March 8, 2024, staffing is a bottleneck. The United Nurses of Alberta reported burnout and shortages pre-COVID, worsened by 2021 wage rollback demands. Per Global News on October 20, 2020, adding 700 beds requires hundreds more nurses, yet Oz struggles to fill shifts. Per Dr. Shelley Duggan in CBC News on December 14, 2023, this is Breaking Bulletin, delivering exhaustive analysis. How the province is addressing hospital bed capacity in Edmonton as of March 15, 2025, involves a 700-bed expansion, surge measures, and systemic tweaks, yet faces skepticism over speed and staffing amidst a decades-long shortfall. What are your thoughts on whether this plan will ease Edmonton's healthcare crisis or merely delay deeper reckoning? Please share your perspective in the comments. I look forward to your views. If you found this report valuable, please like this video, share it with others, and subscribe with the notification bell on for more in-depth coverage. Thank you for joining us. Stay informed, remain engaged, and I will see you in our next update.